Well, welcome everyone to the San University podcast, 39 Gen. And I've got a really awesome guest with me. Now, would you like to tell people who you are and a little bit about what you do?
Hi, I'm Dr. Sonia Tan, Doctor of Acupuncture Oriental Medicine from Yosan, alumni from Yosan. Also originally trained in Canada in the 5-year Doctorate of Traditional Chinese Medicine diploma program. My license is from Canada, so I have the registered TCM practitioner license. So that's herbs and acupuncture. Let's see, that's my most recent academic side, though I originally was in banking and healthcare, in business and healthcare prior to that. I used to be a banker, and then I decided I wanted to change, and I wanted to be a sport physiotherapist and have a kinesiology degree, thinking I was going to go into Western allopathic medicine, and then just had a beautiful light bulb moment where I realized that Chinese medicine was my passion. So I decided to go back for school.
That's awesome.
For that, and look at this is where I'm at now. That's a very short story, which just focuses on my academics of who I am.
That's awesome. Well, what was it that what was the aha moment? What was the catalyst for that? Do you mind if I ask?
Oh, sure. I mean, I definitely speak about it every time I teach. I think people can relate to this. So I actually grew up with allergies and asthma from the time that I can remember, 5 or 6, severe, where I would get swollen eyes, mouth, fingers. I had to be on daily injection, weekly medication, and I had to have a puffer for my asthma, which was exercise induced. So that was about 15 years I was on it. Wow. And in and around my early 20s, I was also an elite rhythmic gymnast. And I was having trouble finishing a 3-minute routine in my 20s, around 20, I think 20 or 21. The medication was not helping anymore. And I had changed medication. So I think people can relate to this when things aren't working for you anymore in the medical paradigm you're using. And there's a frustration level with that. So making the long story short, I ended up by fate seeing a shiatsu massage therapist because of I wanted to get my upper back that was really tight that I thought was from gymnastics to open up and release because I had competition coming up. And at the end of the session, she had said, "Oh, do you have any lung problems?"
Interesting.
And I was floored because I did. I had asthma. And I said, "Yeah, how did you know?" She said, "Because every point that you complained about being sore, which was actually all along my arm, was my lung channel."
Interesting. And
she said, "You should see my acupuncturist." And that wasn't exactly the light bulb moment, but that was the catalyst for the light bulb moment later. You know, I grew up with my grandfather growing herbs in the backyard. I have his acupuncture charts in my clinic. But when you're a kid, you don't always listen to what your grandfather's saying and telling you. So right. You need something to kind of wake you up. So it was amazing. Acupuncture cured me of my allergies and asthma. I committed to, for 6 months, she got rid of my asthma. I was able to compete. Then I committed to a year later of decoctions and acupuncture. And I was completely cured. And this is me being on medication for 15 years. It was a year and a half of treatment. So fast forward, it was when I was working as a kinesiologist, thinking I was going to go into that field. And as I'm working with the clients, you know, they were receiving acupuncture from physiotherapists. I know that's not always like happy for people, but it's the reality. At least they're helping people. And I was so excited to say, "How is that working for you? How's that? Is it great?" You know, because I was so excited about how much it helped me. I wanted to see if it was really helping them. And it was just one day there that I realized, this is what I'm so excited about talking about. I really need to do this.
That's awesome.
And I changed. Yeah.
That's awesome. You know, you hear these stories about people who find the medicine for different reasons, but it's always this powerful story when you get people that had these transformative effects that happen in their own life or to people that were around them. I had a classmate years ago in school who he found the medicine because he had gone from doctor to doctor to seek out health solutions for his mom. And, finally, she started to get better when he took her to an acupuncturist, and he was like, immediately said, I'm dedicating my life to this. If I can help someone else the way that this person helped my mom, then I'm living a good life. And it's
Yes,
powerful.
exactly. Yeah, it's powerful. Yeah, that's how I feel. If I can help people the way I feel I've been helped, and how I know my body feels being just naturally on its own. I didn't realize how different my body felt being on all of that pharmaceuticals. I was vibrating and I didn't realize it till I was off of it, off of all the medication. So if I can help even in little ways, even like quality of life, relief care, that to me is such a great service.
Right. It's powerful. Now you changed, went down this path, but talk to me about, one of the things that we had talked about was your lineage. Can you tell me a little bit about your lineage
Mm.
and the journey that you had there?
Yeah. Well, I will speak first about my paternal grandfather, Grandpa Tan, and the Tan family. The Tan side of the family has been the history can be traced about 500 years in
Wow.
China, but in the history of China, those that know, the sunset years of the Qing dynasty was a very dire time. It was very poor. There was a mass exodus of people trying to find a new life. My grandfather had learned skills of the metaphysical arts from a monk. He had learned the astrology. He learned some Feng Shui. He learned Chinese herbs, and he learned Chinese face reading. And in Indonesia, he migrated to Indonesia. He had learned from a monk that took him under his wing and really taught him all these arts. And he had started practicing that in the streets of Indonesia. And really, when he started his family, he was still doing that. I grew up with him and my father telling me all these little things, these little tidbits. And it really floored me as I saw some of the things or truths happen. So one of the things my grandfather was, he was such a talented astrologer. My father would tell me things, of course, after it would happen, because you should never, there's an art to what you really say and what you don't say. And even with face reading, like there's a story that I distinctly remember of my father. He said, I heard my grandfather would tell my father growing up, oh, you shouldn't be dating that person. And my father would say, why? Well, because that person's going to be very poor. And if you're with them, that will be your destiny also. And my father would listen to my grandfather because he would hear his clients come back and say, you were right, you were right. So of course my father knew that my grandfather was pretty talented. And even with astrology, so you can imagine how that guides someone's life, right? And even with astrology, I've done a lot of school. I mean, I've just went through a little bit of my history, and I've done a lot of school. And initially, my father in high school was both my parents were quite strict with what I should do, my academics, all of that. And when I wanted to change careers, I was actually quite fearful of telling my parents. I thought they would disapprove, but I was changing it for me, because initially the first degree, the business degree, was really for them. It wasn't for me. But then when I told my parents, my mother didn't want me to change. She's like, "Oh, why do you want to change? You've got your career." Da, da, da. Like, so I had the expected freak out. But then my father, was very strict early on. He just sat chill and he said, "Sure, that's fine." And I thought, thinking, who are you? What did you do with my father? Because this isn't what I expected.
Right.
And I said, why are you so okay with this? And he said, because your grandfather told me that you would do a lot of school. And that's okay. I'm like, wow. But look at how that changes how you are as a parent.
Mm-hmm.
Look at how that changes your relationship with people. And that's one of the things why I love astrology so much. So I knew that I was going to dive into that. When I was going through university, I chose to take my elective courses in Asian studies so I could learn more about my culture. That I was kind of between two worlds. I was growing up in Canada, the Western culture, and then at home, the Chinese culture. And, with parents and grandparents, they say, well, we do this just because. We can't give you the whys. We do this because, right? And I was the kind of person, like, I want to know the whys. I want to know the whys.
Yeah.
So Chinese medicine and my Asian studies has provided me a lot of the whys. And it's provided me that, that connection back. I'm like, now I understand why we do that behavior, why we do that culture. Like, I understand it at a deeper level. And so I'm trying to tie in that lineage, where that's where I really appreciate what everything my grandfather was saying. And then I realized, this integration, I understand much more. So as I started to learn more of the arts that are not taught in traditional Chinese medicine school, as you know, like there's a lot of acupuncture that's not taught in school. So that's the other lineage, is Dr. Richard Tan. And Dr. Richard Tan is something that I had met while I was school, but I followed immediately. So I'm tying this in because during the Asian studies, I had studied the I Ching.
Yeah.
And I studied the beauty of the I Ching. I was so fascinated. I ended up getting a tattoo of the Wenwan Gua on me. I was just so fascinated how these little symbols could mean and symbolize so much, and how much wisdom there was in it. So then as a student, I went to a seminar here in Canada where they had Richard Tan as a guest. And he presented how the I Ching was connected to the acupuncture channels. So I was hooked from that moment on, because I had already been studying the I Ching since 20. And I followed him immediately. And so then fast forward 12 or so plus years later, I was able to become one of his gold level senior students. And gold level, but also one of his senior 16. There's 16 of us that graduated at his highest level, his most advanced class. We still refer to each other as brother and sister, and most of us still chat amongst each other. And we're really about trying to continue to pass on the beauty of that lineage. Now, Dr. Richard Tan wasn't solely the only creation of the balance method or balance system. Within that, there is holography that exists in the classics from 2,000 years ago. The I Ching, that's all from the classics. He created patterns, and he created a system for us to understand it and know, and easy to learn and apply. He deserves all that credit. He was a genius and a charismatic teacher. And then he had another system within it called the 12 magical system, within it, or the 12 meridian system within it. So I felt very fortunate to be a part of that group. And so when he passed away, there's 3 of us that have been dedicating our life to continue to pass on this classical knowledge. Basically, it's classical Chinese medicine, classical acupuncture, that's been forsaken in contemporary education for the sake of, I guess, contemporary education trying to create licensing. But you still have all this wisdom outside of that from 2,000 years ago that's really effective. So that's another part of my lineage. So part of my lineage is from Grandpa Tan. And I went to study under 3 different astrology and Feng Shui teachers, and then became certified in astrology and Feng Shui since 2011. And I've been practicing that professionally. So I really feel that part of me is me passing on what my grandpa had taught me and trying to integrate that with the teachers and pass that along. And the acupuncture part, and some of my grandpa, I have all his herbal books as well. And then the acupuncture part is me trying to pass on the lineage from Richard Tan and classical acupuncture that's from the books, and that's been documented, and passing that on and refining it in a way that is easy to learn, easy to apply, effective results. Because at the end of the day, we want to have better outcomes for our patients. So I just want to keep passing on what's effective and what I know can really help.
That's awesome. There's so much to unpack there. That's awesome.
I know. I didn't even talk about my maternal grandfather, but that's fine. That's a lot there.
Yeah. Well, wow. What's your favorite part of the medicine? Like that, how you practice right now? What is it that when you wake up in the morning, what is it that still calls you to the medicine?
I really love that, when I teach acupuncture, I always talk about the WTF moment, because with balance acupuncture, because the effects are so immediate and so quick, you get that WTF. I don't think I can swear on here, so I'm not going to swear. You know, that WTF moment, right?
Yeah.
And you get that light bulb face, right? And then they come back and they're feeling so much better. They feel so much more alive. They feel so much whole. So what wakes me up and drives me in the morning is helping people with effective results, helping people just get that quality of life relief care, getting that wholeness, that health, that natural health back. I've received an email just the other day about just even the thanks. Like, thank you for helping me. I'm cancer free, and I know it was all your help, with combined with the chemo radiation, So that's what drives me. I mean, the acupuncture and Chinese medicine is really, when it comes down to it, it's a benevolent service to fellow humans. And that's what
That's awesome.
really drives me. It really fulfills me. Yeah.
And it goes back to that, the ability to make a difference in someone's life. There is this, we forget, a lot of people forget that simple actions can have profound results in someone's life. And I remember one of my first experiences with acupuncture and herbal medicine was this. I was really young and I was playing sports. I was playing volleyball, and I also was doing martial arts, and I had kind of like I was doing judo, and I had a bad fall, and I went and got an X-ray, and they were like, "Well, it looks like there might be a thin hairline crack in the bone." They're like, "Just rest." It wasn't a fracture. It was just some stress and torsion, and it looks like there was some stress along the bone. And I was just like, I wouldn't even know what that means, man. But okay, I rested 6 weeks. I took time to heal, and I wore a boot during that time. And when I got better though, and let everything heal, I got better, but yet it didn't. Like, things were really still sore, and and I was doing the exercises that I was told to do. I was doing the rehab that I was told to do, but it still hurt. And whatever I could do, it was just really, really painful. And finally, someone was like, "Hey, maybe you should go try acupuncture. There's this guy down the road." And I jumped in there, and I did acupuncture and took some herbs. It was amazing. It was dramatic. It was very much what you described, that WTF moment, where it was like, "Wow, my leg feels better." And not just my leg, now everything feels better. There was all of these aches and pains that are now resolving.
Yeah.
And I was like,
Right.
I didn't even know that was possible. I didn't even know I needed to have certain things treated. And it was just like, we so many people go through their day dealing with aches and pains, and they don't realize they don't have to. They don't have to.
Oh yeah, they don't have to. And how many times now that you would say in practice, do you know that's not normal?
Yeah.
It doesn't have to be that way, right? That's not normal. Like an example of, say, a female that has menstrual cramps that are like 5 or more out of 10. Do you know that's not normal, and you don't have to live that way and suffer that way? What? Really? Yes, really. And then, so I have this story where I have this family come in, and the mother started having her teenage daughter come in, and she said, "I want you to teach her about women's health, please." I'm like, "Okay, I'll do what I can," and da da da. So I did. I just started educating her. Here's what's normal about a period in the Chinese medicine view. Your cramp should be 2 or less out of 10 or nothing. You shouldn't have many mood swings. You shouldn't have, this would all be normal. This should be the day, just educating. And then the mother came, when I saw the mother at one point, this is like 6 or so months later, said, "You know what my daughter said to me the other day?" She said, "Dr. Sonia said that my periods should be 2 or less out of 10 for cramps." And so I just felt kind of proud, because it's like, oh, she heard me. She's kind of listening. And the mother's like, "Yeah." And the daughter said, like, her cramps are 0. And she knows, like, she's good, that she's okay. And that if it goes beyond, then she should get treated. So these are like little proud moments, because I think this, but one of the Chinese medicine strengths is one of the greatest strengths is it's preventative medicine.
Yeah.
We have so many ways to see how to prevent things, because you have this paradigm to work with to say, okay, this is what's normal. And if we see this, these little things, if we catch it right now, we can prevent 5 steps later from happening.
Yes.
Where the body's screaming at you, right? So that's the beauty. I mean, that's also really fulfilling when I get patients that are coming in. I'm just here for my tune-up.
Yeah.
Just love it.
Yeah.
I feel so fulfilled as a practitioner. I'm like, I've educated you to the point that you're just coming for the tune-ups, preventative care. That's real health care. It's not sick care. It's health care.
Right.
I just love it.
There was a book. I cannot remember the name of the book. I will look it up and email it to you later. But it's a great book on channel theory. And there's this quote at the beginning from the classics. And it's like, even the most difficult disease can be treated if you find that source of the problem. One of the things I think about is my daughter has this silver chain that my mom gave to her. And the other day she came to me and she's like, Daddy, look at this knot. It is so knotted. And she's like, what can we do? Yeah, do I need to just toss this out? Do I need to get rid of it? I was like, no. We need to find. There's a spot in there that is holding this whole knot together. We need to find it. We need to start unraveling and pulling out the pieces and finding ways to unravel the knot. And then slowly we worked our way backwards. And then finally this necklace was wide open again. And she was just looking at this necklace and she's like, wow, I thought that everything was, done. And I said, no, if you can just, and that analogy always makes me think of acupuncture, that, simply
so perfect.
One needle at that right spot where that internal knot is at can release everything.
Absolutely. And that's very much channel-based acupuncture or classical acupuncture. It's always looking at where channel's flowing. It's not like a herbalist-based approach to acupuncture, which is the TCM, where it's looking at what can we supplement you with what you're missing. That's a different way of looking at it. It's really channel-based acupuncture. If you talk to anyone that does it, even like 8 Extras channel acupuncture in Jeffrey Ewan's lectures, it's circulation. It's knowing where things circulate. Where's the blockages? Where do things flow? How to reconnect and balance that circulation. And when you have that, you have resources. And when you have resources, you have capacity, you have strength, you have the ability to regenerate, and that circulates. So that's such a great analogy, Sean, that knot.
It's a great one, right? It was some. Yeah. I get these little aha moments as I'm driving through my day. One of the ones that I had the other day was about yin and yang as I saw traffic, and as I was driving through the streets. Because in Vietnam, there's this interesting phenomenon where everyone goes down this side, to the right, and then people come back down the left. But yet within that, on the right side, there are people also coming back this way. On the outside, and on the left side, there's also people going the opposite way, and I'm just like, yin within yang within yin, and I see it now. I get it.
It's everywhere. Yeah, right.
It is.
Yeah, it changes your whole lens of the world when you learn about all of those, the yin yang, the 5 phases, and I always say this to my students that want to learn. First of all, when they learn balance acupuncture or channel-based acupuncture, it's changing the way you look at the body and how you look at functionality. And then if you choose to learn astrology and Feng Shui, it completely changes the way you see the world, and also how you interact with people, how you think about people, the communication with people, your compassion for people. Totally changes the world. But I think it's a really good thing for everyone to know that. I mean, it's a good way for us to have knowledge. Information is always useful, especially if we can learn and build on that.
I love that. Talk to me. Do you mind talking a little bit about how do you apply some of the astrology and Feng Shui and these other practices in your acupuncture practice, or are these things that you do more separately?
There is a handful or a small percentage that I integrated in the practice into my acupuncture or clinical practice. So I don't just do acupuncture; I practice herbs also. And the reason is that for astrology specifically, because there's a very karmic in my lineage and my teaching, it's very karmic, let's say, for lack of a better word. So you need to treat the astrology energy with great care, sacredness, and integrity. I'm not one of those teachers that believes in just teaching it frivolously to everyone without teaching them that the large impact that can have, how you talk about it, how you use it. So when I think that I need to apply this with the acupuncture treatment or in lifestyle, I will first have a conversation about it with my patient and talk to them about what it is, how I'm using their constitutional energy, how I can see their constitutional energy, and how I can use it to apply it in their health. And do I have their permission?
Mm-hmm.
That's very important. I wouldn't just draw up their chart, look at their chart, and then just talk to them about it without their permission. That is absolutely not using it correctly or karmically or sacred, which will come back at you. And then I always talk to them about, because it's the three arts, is adding Feng Shui, because really a physician would use the astrology knowledge, which is your constitutional energy,
Mm-hmm.
knowing your constitutional DNA is basically what it is. And then when I know that, I know what's your helpful energetic phase that you need or phases. I can apply that in acupuncture. I can apply that in herbs. I can apply that in their lifestyle. I can apply that in Feng Shui. So say, for example, somebody needs a lot of fire in their constitution. So I can apply that in the channels, herbs, diet, lifestyle. But in Feng Shui, I would say, well, you need to live in a sunny environment. You should not live in a damp climate or cold climate. So if they are, like where I live in Vancouver, Canada, it's the Pacific Northwest. It's a rainforest. So it's probably not the best place for them for their health.
Yeah.
If they can't move, then in the building or the place they choose to live in, it would be like, okay, well, this is where you should work. This is where you should sleep. This is how you should arrange to sleep. Your chest should face south so you can absorb the sunlight. You should, try to situate or spend the most time in the sunniest part of the room. Now, Feng Shui is a bit tricky because you also need to see the blueprint of the energetic sectors and see what's happening there before you advise this is the best place. So it really begins with a conversation. I don't do it automatically. So there are a handful that we're integrating all three. Majority of them are still in just acupuncture, whether it's bounce acupuncture, 8 extras. It's all channel theory, classical acupuncture that I do, or with herbs. And I might have astrology just as a communication tool for them, but they haven't necessarily wanted to integrate or the Feng Shui. And I haven't necessarily seen a high enough need for me to say, I think you should consider this now. So, because some of it's powerful enough, some of the acupuncture and herbs are powerful enough.
Yeah.
Some situations, no, you can see that it's warranted, that a change is needed.
That's awesome.
It wasn't a very short answer.
No, but it's a great answer.
I don't give short answers, I think.
I love that. I love that. I remember I had one guest and it was all short answers and I was just like, oh, I don't know how to pull anything out of you.
Yeah.
What if you could go back and start over your whole studies? What would you lean into more? What rabbit holes would you like to go down?
I don't know. I'm pretty satisfied, because after I felt like I learned all I could with balance acupuncture and balance acupuncture channel theory with Dr. Richard Tan, because I became one of his senior students, took every single course. At the same time, at that same conference that I met Dr. Richard Tan, I had met Jeffrey Ewan because there was another speaker, a group of speakers there. I was also equally fascinated and satisfied in following Jeffrey Ewan because he was speaking also from a very channel theory, but he was also talking from a place where here's the classical medicine that it's not included in the contemporary Chinese medicine schools. And because I had grown up with that kind of learning, that was something that had appealed to me with the stuff that's not the mainstream TCM way, because that was only the TCM way of learning was only created in the 50s and 60s and 70s, right? Very recent. So I knew I couldn't follow two people at once. And if I could say to any student, I would say to them, try to really focus and get good at one area before you jump to another area. It's difficult when you're trying to spread yourself out and learn many things. You don't really master one thing really well. But I knew I wanted to come back to take more courses with Jeffrey Ewan. And I have been for the last, I would say 7-8 years. So I'm feeling really satisfied. If I were to go back, what would I dive more into? I don't know, like maybe more I Ching, maybe more. I'm not sure. I think I feel very lucky that I've had the time and the opportunities to fulfill those desires of the areas of learning. Would I learn would I go and take more astrology, Feng Shui? No, I've already had 3 teachers. I feel very fulfilled with that. No, there's nothing. I can't give you anything.
Well, let me ask you this way. If you were to give advice to a student just starting out in their journey, what advice would you give them?
Well, if they're starting as a student, one thing I would say is what you're learning now is just scratching the surface. Remember that when you're done, I think everyone said there's a whole bunch of learning that's part of the 2,000 years that you should learn to be effective, to be more effective. I mentioned this earlier, it would be good to focus on one and get really good at one. The other thing I would say to the student is, remember that half of the battle of being successful in clinical practice is not your technical skill and knowledge. It's your soft skill. It's how you can connect and communicate with your patient. It's building that therapeutic relationship and communication skills.
Yes.
That comes from other ways. That comes from other ways of learning. Yeah, you can learn a little bit with astrology, but that comes with other ways of learning how to communicate and to connect and to listen and to hear to a patient. That is by far a big part of your success. And the last thing I would say to someone new in their practice is remember to be consistent and persistent. And what I mean by that is to not really take your foot off the gas with your intention that you're putting out there, the networking or marketing or how you're talking about it. If you keep planting seeds everywhere, it takes around on average 27 touches for a message to get through. 3 before someone hears it, 7 before someone actually understands what you're saying. Now that's already 21 touches, right? So I think the average is 21 to 27. So I always say, just keep persistent. Don't give up. If you're sending out like welcome cards, don't stop because you think no one's appreciating welcome cards. Keep consistent. That's what I would say.
I love that. There's something about consistency that I don't think people always realize. I've been building a YouTube channel with my daughter. It's a fun one that I make for kids. And it's essentially to teach kids fun. A couple of years ago, I was looking for content to share with my daughter because, I was homeschooling her for a year while the world was, flipping upside down. And one of the things that I noticed is there just wasn't a lot of great content out there. And so we started making really simple videos, really simple, where, let's look at this concept. Let's look at this concept. Let's play with an animal. Let's do this. And over time, those early videos were awful. The spirit was there. The ideas were there, but we just weren't making fun videos yet. Now, we're doing great stuff. And you know, we went from about 4 months ago, she had 500 followers, to now we've got 12,000, you know, and it's still
Yeah.
growing.
Oh, amazing.
And, you know, and we've got, you know, got to be about 200 videos up now. And,
yeah.
And we're just each step we put out something good. And it's just with consistency that we get better. And you know,
Yeah.
there was Mr. Beast said, you know, when people come to him asking for advice about making a YouTube channel, he's like, how many videos are you in? And I got about 100. He's like, come talk to me when you've got 100 videos done, because then you're starting to get it.
Yeah.
You're starting to understand your process, not the process everyone told you, but your process. And at that point in time, you know, you start getting better.
Yeah. I think that's with it. With anything, when you're mastering a skills, there's a certain amount of time put in that, like, now you're really understanding. And now you know what gaps that you need or want to fill.
Yeah.
Now that's where you go to the next level. And that's where you can get taken, you know, when you know that. Yeah.
I love it. What do you tend to focus on in your workshops and in the classes that you teach?
So I have been teaching balance acupuncture now for, what year are we? At least 7 years now. So I focus on all the different levels, from the basics to the advanced. I have cohorts or certificate programs where I actually do testing. This is something Dasha 10 never did. I had it at a private institution, an accredited private institution, which was one of Dasha Tan's dream. Dasha Tan meaning Grandmaster Tan, versus Agong Tan is my grandfather Tan. There's a lot of Tans, and then there's myself, Sonia Tan. So try to distinct the Tans. And that was a proud moment. But just to make it better, I knew some of the gaps. Like, okay, we need testing. How do we anchor the learning at a better level, and then really fill the gaps. So when I teach publicly, it's really getting the foundations. If people want to take it to the next level, they enter the certificate program. They get testing. They get more clinical time, grand rounds. They get guest speakers. They get more time with me. But then I'm also been starting to teach astrology, some of the basics, again, through cohorts. I don't really teach that too much publicly. There's some webinars out there. Haven't started teaching Feng Shui yet. I teach different refinement courses within balance. So if you've taken it, if you've taken it and you have gaps to fill, I have these refinement courses that are really meant to be fill the gaps. That all the questions you have, or maybe questions you didn't know you had, or maybe you thought you knew it, and this is typical. Oh, I've taken it once, I know it. So how good are you? How good are your results? Do you really know it? You know, did you know you can do this? Did you know you can do that? Like, you know, and I remember the very first time I actually taught balance, I did a refinement course. I didn't start teaching right from the beginning, because that was what people were asking for, you know, like we want something different. And I was approached by somebody that had been practicing balance for at least 5 or 6 years, had only taken it the one time through Dasha Tan. And then, you know, a lot of people like, oh, then so-and-so taught me just through clinic, just showed me things, right? Which for me, I kind of go, because I don't know if they're being shown the right or correct way. They came up to me after class and said, I had no idea that I could do that with the Jueyin Shaoyang channel conversion. Mm-hmm. I didn't know that. Like, yeah, absolutely, you can. Wow, I've just changed my whole world, and it just changed my practice. And they continued, like, they went back to practice and said, it's completely changed, and my effectiveness has changed. So I also like kind of developing customized courses. So I know there was an organizer that said, hey, can you somehow take, say, the webinar and the practical and put that together and refine and make a practical and case-based course and with practical. I'm like, yeah, sure, I can do that, because I was already kind of doing it on my own or visualizing that. I can put that together. So I guess that's really the kinds of things I the kinds of things I've been teaching and teaching. I'm always thinking of new things, but I also have limited time.
Right.
I've got lots of requests, you know, um, but yeah, I have so much time.
Right. It's a beautiful, it's a powerful thing to realize that we only have so much.
Yeah.
So you got to choose where you put it.